Okay, I'll let you introduce yourself.
Okay, that's fine. So I'm Dr. Holly Tucker from just right down the road, Active Family and Sports Chiropractic. We today are going to be talking about relaxation techniques. So we'll go through a little bit of my background, our approach to stress overall. We're going to do a little activity and then we'll do a giveaway. So what I have here, it's not blowing a full blast because I didn't fill it up with water, but it's an essential oil diffuser. They also can be used as a mini humidifier, and that's what we're going to do as our giveaway today. So essential oils can be used for many different things. How many of you have probably heard of essential oils? They're really growing in popularity right now. So we carry a lot of raw essential oils in our office, and we also carry a lot of blends. So the blend that I have in the diffuser right now is called Cheer Up Buttercup. We have a couple others that I brought in case anybody wants just to test them. Good Morning Sunshine and Mental Focus. So keeping one of these going in your home and in your office can just kind of bring up your mood a little bit, essentially, just like a morale booster. They can also help with certain types of things as far as air quality is concerned. So this is my family. We were at the beach a couple months ago. I actually grew up on the beach in Coral Beach, Florida, so it's kind of a double vacation and family visit for us whenever we get to go down. So my husband and I are both chiropractors. Our names are overlapping there. Sorry about that. So we're both chiropractors, went to school at Logan College of Chiropractic in St. Louis. He got his master's degree in sports science and sports rehab while we were there in St. Louis. We moved down here and opened our practice. I went to UT and got my master's in public health. So I have a special interest in community health education. And really my focus in our practice right now is doing pediatric chiropractic and acupuncture for chronic pain conditions, and also doing nutrition evaluations and weight loss. My husband's kind of the other end of the spectrum. He likes to see elderly patients. He does a lot of sports injuries, really from the high school age on up. He does sports rehab with that. And he also does occupational medicine, so he does DOT physicals, and we do those services in our office. Okay, so overall, we're just talking about different components of health, and when we're going to be thinking about stress here in a second, these are kind of like the big key things that we like to think of when we're thinking about overall health, constitutional type things that can play into a role of you having a stressful environment. So to think about nutrition, the body, or the food that we're taking into our bodies, the amount of water we're taking in, the amount of exercise we're getting, what our mindset is like, pretty much day to day, how you live your life has a lot to do with what your mindset is, and if and that could be a major player in your overall stress. And then your environment. So this could be anything from a work environment, home environment, your actual physical environment you live in, the climate you live in, those sorts of things. So think about stress. Does anybody feel stressed right now? So I love these little word cloud things. So these, you can just kind of see here all the different things that can go into stress and what people think of when they think that they are stressed or they are stressed, and all the things that go into that. And physical or emotional stress can manifest physically in the body. We see that a lot with our patients. So even if there is nothing, no big injury that's happened or anything like that with anybody, just their emotional health can manifest as pain or symptoms that go on in the body. And so that's a big component of the things that we see. A lot of times, a big part of what we do with our patients is a lot of just that interaction with them and positive affirmations with them that things are okay, you're going to be okay, because a lot of people can catastrophize if they don't really know what's going on, or if they get on Google and you search their symptoms, they end up thinking you have a very bad prognosis. Okay, so different types of stress. Kind of alluded to this already. We have emotional and mental type stress. Physical type stress, and this is impacted by the role of manual labor, injuries, and chronic pain conditions. So even if you're not in a really strenuous type job, you can have physical stress even at like a desk type job. So what we call ergonomic stress, repetitive actions, certain things that can impact what's going on in your body. Lifestyle stress, so social environments, your living situation, that sort of thing. Smoking falls under this category, risky behavior dietary component, so overall the standard American diet is very pro-inflammatory in the body. And that can play a role pretty much everywhere in the body. So the food that we eat is, to the nourishment of our bodies, but if we're eating a very inflammatory diet, that can put us like right on the cusp of having certain inflammatory conditions going on in the body. And that can be anywhere from chronic pain, headaches, certain types of hormonal things that are going on. So in our office, we like to go over with patients, what are those really inflaming foods? And a lot of people know that, fried foods are not good for you and that sort of thing. But sugar is another big thing, is major inflammatory component in the diet. Caffeine can also increase levels of stress momentarily in the body, just because it can increase your heart rate and your breathing. And the role of water and how much water you take in. So if you think about on a cellular level, if your cells don't have the proper nutrients to get by, then disease can start to form within the body. So if we don't have the right amount of fats and proteins and water in our body, we can create a small stressful environment there. And then environmental, already talked about that as far as air quality, noise pollution, and then access to clean water. So fortunately, most areas in this country have access to clean water, and that's one thing we don't really have to worry about on a daily basis. So acute versus chronic. So acute stress is a sympathetic response of fight or flight. So something just happened, maybe you just got in a car accident, or you're out in the woods and you see a big animal you weren't expecting to see. Your body has a hormonal response to that. It's called a sympathetic response. Your eyes will dilate so you can see everything that's going on. Sometimes you'll sweat, you get a rapid heart rate, and that's all geared towards finding you a place for you to be in a safe place, and then your body can calm back down. If you think about an injury, if you break an arm or you cut yourself or something like that, you are going to have some inflammation in that area, and that promotes healing. So you get a cut on your arm, you need those inflammatory cells to come and repair that area and regain your tissue function. When we think about chronic stress, this is repeated exposures to small, it can be with micro traumas or just long-term events that are stressful, especially if your environment around you is stressful. So the hormonal responses there, you eventually would develop like high blood pressure. It can affect your sugar balance, like your insulin sensitivity and that sort of thing. And it overall can decrease your immune response, so that when you do get sick or you do get exposed to some sort of germ like a virus or bacteria, or you do get a cut or something, it takes you longer to heal because your body is already at the point of being maximally stressed. So that's where we get tissue fatigue. So we see certain things like autoimmune diseases start to set up, and that's sort of in the body. Okay. All right, so a little bit more focused on what we do in our office when we're addressing stress with patients. So I would say about 75% of the time, we're mostly seeing people more in that chronic realm. Every once in a while, we have some acute people, walk in the door that may have just dislocated their shoulder or something like that, or think they've broken their foot. But most of the time, we're dealing with people that have been living in pain, with certain conditions for a long time. Okay. So a little background on acupuncture. It was developed out of ancient Chinese medicine between 3,000 and 4,000 years ago. I've seen others data that said 2,000 years ago to 5,000 years ago. But essentially, what acupuncture is ancient Chinese medicine was very holistic in that they view everything in your environment, in your whole body, as being connected. And that you have an energy within you, as well as your environment has its own energy. So if we see up here, these are all the acupuncture points, and the lines that are running up and down the body are called meridians. And those are the pathways of energy that they identified as far as how the body communicates, essentially. So we have 14 main meridians. 12 of them cross at the wrists and the ankles, and then the other 2 run up the middle, the front and the back of the body. And they're responsible for communications that are going inside and outside of the body. So if there's any sort of injury or chronic stress in the environment, then these meridians become out of balance, and that's a source of things that we can be able to treat with acupuncture. So with acupuncture, I do use needles. They do look almost exactly like that. I did bring a couple with me if anybody does want to see or touch them. So very small. They're quote painless. You do feel them go in just a little bit of a pinch, and I leave them in for about 15 to 20 minutes, but they don't hurt that whole time. You don't even feel them. Sometimes people, when I come back in the room after I've been away for a few minutes, people describe a certain sensation that they're feeling, and everybody describes it a little bit differently. Sometimes you don't feel anything. Sometimes you just lay on the table and relax. I would say the number one side effect to acupuncture is relaxation, because a lot of times, you're not getting a time of the day where you're just laying down and you're, by yourself with your own thoughts, without intention of going to sleep, just laying there and relaxing. So a lot of people get a lot of benefit from that. Okay. So talking a little bit more about meridian therapy. So I do a meridian analysis when patients come into our office. And so we're really looking at what's going on there. Is everything balanced? Is everything communicating well? And if it's not, we want to get the energy flowing back in that certain direction. There is a microsystem that is on the surface of the ear, actually. So you see up here in the picture, there's a representation of the body on the ear there. This is you see the big skull here, and then the spine goes up. That's that big crease in your ear. And then there are also points that relate back to your brain and mental health that are represented on the ear as well. So that's some of these I pulled here. Shinmin is a good one specifically for relaxation. We have muscle relaxation here, a tranquilizer, which is just helps with relaxing as well. You see hunger point up there. A lot of people, I would say half the people I see for acupuncture come in and say, I heard somebody got acupuncture for weight loss. So yeah, there is a point for hunger and there's a point for appetite control in the ear. We take more of a comprehensive approach when it comes to weight loss, because it would definitely be a disservice if I just said, yes, I'm going to stick you with a needle right in your ear and you're going to lose weight. We really have to take in the big picture there and see, okay, making sure you're not leaving my office and driving straight to McDonald's, and we want to get you moving and those sorts of things. So yeah, the ears are really powerful when it comes to mental health type things. And I tell people that are stressed a lot, a good relaxation technique to do is just to rub your ears, just to get that stimulus. Because a lot of people, almost never touch their ears. Women may touch their ears when they go to put in, like an earring or something like that. But just, give them a good rub all the way around, a few times a day, or when you're really particularly feeling a stressful moment. This is really powerful for children as well, especially children like autistic children or anything like that have behavioral type issues. Teaching them to do it themselves is really powerful too. Okay. So another caveat we have here, as far as a relaxation type technique, is exercise. So cardiovascular exercise has been proven great for many things, but overall it can increase your cellular level of stress you have going on in your body. So while you're exercising, you're actually, quote, stressing your body, but once you're done, it has a lowering effect on your blood pressure and on your pulse rate. So people who regularly exercise usually have a lower resting heart rate. And I am not going to be demonstrating. So that was most likely some type of yoga or Pilates there. Those are really good types of exercises, usually to do in a group setting. I mean, you can certainly do them at home. There are lots of DVDs and videos and things like that to do online, but I find usually in group settings that social interaction kind of boosts the effect of the exercise itself. So doing yoga and Pilates, and those really focus on breathing, and we're going to do a little breathing exercise here in a second, but those focus on breathing, stretching, balance, flexibility, as we saw in the picture before, and then strength training and cardiovascular exercise I already mentioned has a lowering effect on relaxation. Okay, so meditation is another tool in our bag. This is something that definitely takes some practice. A lot of people don't really know what meditation is, or think that they have to have like this special room, this special place. You can really meditate anywhere, just having a moment to yourself, with your thoughts. Doing guided imagery is also really a good thing to do. And these days everybody's got a smartphone. There's an app for that. You can go and you find apps that'll help you go through that guided imagery talk you through your breaths and stuff like that, and your positive affirmations. You can do meditation in many different ways. You can do it, by yourself, sitting on a beach if you have access to one of those. But I really like to stress and focus on, finding little ways to help do this throughout the day. Add it to your normal routine. Don't make it to where we have to go to a special place to do this. So go ahead and go forward there. All of those. Let's go forward one more. So this is going to explain the diaphragmatic breathing exercise. So we're going to have everybody do this. I want you to place one hand on your chest up here and one hand on your belly. And just start off with, I want you to take in a big deep breath in through your nose and out through your mouth. Okay, so how many of you felt your top hand rise? Okay, how many of you felt your bottom hand rise? Okay, a couple. So the ideal here would actually be that we're causing that bottom hand to rise more than the top hand. The top hand really shouldn't rise that much, because what you're doing when you're taking a big deep breath and that top hand is rising, you're activating all of the accessory muscles up here, and that's really just causing you to be more in a different type of posture than you really should be able to be. So what we really want to do is key in the diaphragm. The diaphragm's that big muscle right at the bottom of your rib cage that's responsible for expanding your entire rib cage there. So we really want to focus on, pretend you're wearing your favorite pair of pajama pants. You really want to push those out all the way around when you're taking in that big deep breath. So let's try one more breath this time. We're going to do a slow 4 counts in, hold it for 2 seconds, and then a 6 count out. Just do a couple of those. So everybody feel that the difference between moving the top hand versus moving the bottom hand. This is certainly something, once you really learn how to do it, you can do it at your desk. You don't have to be doing it, with hands on your chest and your abdomen. Do it laying down. That's also another good way to learn how to do that. And this is just a quick, easy way to say, I'm going to take a minute to take in a few deep breaths. And this really helps with the overall relaxation of the technique. How are we on time? Good. Okay. Oh, we're about at the end. So this is just an overview of the services that we offer at our office. So chiropractic care is going to be addressing any type of physical stress, like I said, the chronic type conditions that we see in our office. Because if you think about it, you only get a certain amount of energy per day necessarily, before you are mentally exhausted and physically exhausted. So that's replenished with the food that you eat and the rest that you take and everything like that. If you wake up in the morning and you're dealing with a chronic condition like chronic pain or an injury or something like that, that automatically just cuts down your available energy for your day. And so if you address those physical aspects of where your energy pie goes essentially throughout the day, then you have more energy to be able to heal in other processes of your body and not be stressed. So we're talking about acupuncture for emotional stress and also for chronic pain conditions. One of the biggest things I've been seeing here recently is post-surgical pain. So, of course, being chiropractors, we see a lot of low back pain, neck pain in our office. And a lot of people have had surgical interventions in these places. And sometimes that surgery leaves them with a different pain or a pain that just won't go away. And so we can do acupuncture for that and actually help to override those pain signals that are being sent back into the brain. Because the acupuncture is such a different specific type of stimulation in the brain that's different than pretty much any other modality that you can do. So we address nutrition and supplementation. So like I said, we're talking about an anti-inflammatory diet. We have a lot of supplements that we can recommend to patients that improve their mood, sleep, and overall well-being. And then we have the essential oils and diffusers. Barely blowing out there. So what an essential oil diffuser is this is filled with water. This thing tips over. It's by the maximum or opposite there. And reservoir in the bottom there. So you put water in it, and you put a few drops of essential oil, and it'll diffuse it into the air, kind of like a small version of a humidifier. Excellent. Any questions, comments, concerns about anything? What time is it?
What time are we?
10 till. Okay. After that, we'll test a little. That's fine. Okay, so you can go to the next slide. So frequently asked questions. Of course, I always do the does it hurt, how big is it, that sort of thing. So this is just a graphic. You can almost barely see the acupuncture needle there, and I'll get the ones I brought with me to show you. So yeah, this is comparing an acupuncture needle to a sewing needle, a medical syringe, and a matchstick. So of course people will say, I don't like needles because I don't like having my blood drawn, or I like getting a shot, or that sort of thing. Look how much bigger the medical syringe is compared to the acupuncture needles. The acupuncture needle is solid. It doesn't have to be hollow because we're not pulling or pushing any fluids through it. So it's very small, about the size of a human hair. I've got one little pack here. This is a pack of 10. Probably most of you can see the big blue thing. That's just a little tube that we send it down through and then tap it in. You can see the silver handle, and most of you probably can't even see, but I'll pass that around. You can see how big they are. So like I said, usually feel a little tap or a little prick when they go in, and you don't feel them the whole time. They leave them in about 20 minutes.
So how long do the results last?
Everybody, is a little bit different. Every case responds a little bit differently. Most of the time, I would say, with like painful type conditions like chronic pain and that sort of thing, you're going to need to give it a few sessions. And I say for most of my post-surgical cases that we give it up to about 10 sessions before we're at a point where everybody's good with progress, essentially. But as far as for relaxation, you're going to feel that the first visit. I mean, you're definitely going to feel the effects of that. It just depends on how long it lasts. So there is a cumulative effect. Usually I'll do a few sessions back to back, and then we'll start to space it out, based on how patients are feeling, as far as how long their relief is lasting.
Does anybody have any other questions? Well, thank you for coming and talking to us. I appreciate it.
And these are our little testers. If you want to smell any of these little essential oils, pass them around here. And then what I'm going to raffle off today is Cheer Up Buttercup, which is a blend of bergamot, orange, lime, grapefruit, and lemon oil. So it's citrus.